Imagine a situation where you don't recognize your own brother. Yes, your own brother. I'm not talking about a hypothetical situation here. I'm talking about a real scenario which happened to me once. A patient walked into my chamber one day and then he said, "Doctor, my brother is staying upstairs in my house on the top of the building. And then when I come out of my house, he waves at me. I don't see him, and then I fail to wave back. This has been happening to me for years together, and this has created a real crisis in my situation. My sister-in-law has started distrusting me, and so it's also happened that my brother is distrusting me now. They don't know why, but I keep telling them that I don't see clearly, but they don't believe me. Doctor, can you just check me and tell me what's wrong with me?" So it happened that I put him through the mandatory checks that we do as a routine eye examination, and then I realized that this patient is having a very advanced form of glaucoma. Yes, dear friends, glaucoma can cause such a blinding situation that you may end up in a situation where you may not even recognize your own brother. I am Dr. Sirish Nelivigi from Nelivigi Eye Hospital. I am the director there. And glaucoma is my special interest, and I've been treating glaucoma patients for about 20 years. And please believe me, once you see these glaucoma patients, you will realize that there is nothing more dreadful than suffering from glaucoma and being blinded in your life. Let me relate you another anecdote where we had a situation where there was a patient who is one of the top financial advisors of the country. He came and told me that he's been attending roughly about like 3 to 4 meetings every day. Now he's reached a situation where when he sits in the meeting, he's not able to recognize the people who are sitting in the meeting. When he doesn't recognize, these people are suspecting, why is he doing like that? Does he not like me? You can imagine how much of an uneasy situation these scenarios can create. And again, even the second anecdote that I'm telling is not a hypothetical situation. It's a real situation which happened. And then again, this patient had a glaucoma so advanced that he's reached a stage now that he's stopped all his meetings, and then he hardly travels out of the home. Is it a rare condition? No, not at all. About 12 million people in India suffer from this disease. All above 40 need to be careful. Roughly about 40 million people are either having glaucoma or are prone to get glaucoma in our country. I wanted to stress upon you the fact that when the patient walks into our chamber, the situation is so bad that he's already lost roughly about 90% of his vision, and the even worse part is that he never realized it all the while. We call this disease as the silent thief of vision just for this reason. Glaucoma is a situation where the fluid in the eye, which is called as the aqueous humor, fails to drain out properly from this zone to out of the eye. This happens because there is a clog in the meshwork which drains the fluid out of the eye. Because this fluid doesn't drain properly out of the eye, as a result, it just builds inside the eye, and this can result in rise of the pressure inside the eye. This raised pressure inside the eye, what does it cause? It in turn put pressure on the different structures of the eye, and most notably a nerve called as the optic nerve. Optic nerve is the nerve connecting the eye and the brain, and then when this increased pressure puts the pressure in turn on the optic nerve gets damaged, and then the signals that are supposed to go from the eye to the brain fail to get conducted all the way, and then the resultant situation is that we don't see. Now, how do we find out that a patient has glaucoma? As I said, in most of the situations, a patient may not know that he has glaucoma. And as I said, 90% of the people do not know that they have glaucoma. In the remaining 10%, or even in these 90% of the patients, in the late stages, the only symptom or the only sign is that the patient will start feeling difficulty in the peripheral vision. In a very simple situation or a very common situation, what happens is you go to shake hand to somebody, or somebody comes to shake hand to you, and then you are not able to see their hand because his peripheral vision is gone and he is only able to see the central part. This is called tubular vision. The tubular vision happens in the very advanced stages of glaucoma, where a patient understands that he has a problem. By then the situation is too late. Now, what are the causes of glaucoma? The vast majority of these patients who have glaucoma get it because they have a family history of glaucoma. Either their father may have it, or mother may have it, or grandparents may have it, and by default they end up getting glaucoma. This constitutes anything between 40 to 60% of the population. Now, in the remaining part of the population, there can be some specific causes which cause glaucoma. It can be something like a medicine which they take for some other disease, say for example rheumatoid arthritis. Some of the medicines which can cause depression, some of the medicines which cause anxiety, quite a lot of these medications can cause glaucoma. There can also be situations which cause inflammation within the eye, which we call it as uveitis, and this uveitis can cause glaucoma. To understand glaucoma, let me give you an example. Imagine a wash basin, and imagine a tap on top of that, and then imagine a drainage at the bottom of it. Now, also imagine that the tap is fully on, and then all the water is falling into the wash basin, and then it is getting drained out through the drain at the bottom. Now, there can be different scenarios. There can be a situation where what normally happens is the amount of water coming into the tap and the amount of drainage that goes out is all equal. Now, imagine another situation where there is a block in the drainage that's going out. Now, you have adequate amount of water coming in from the top, but then the drainage is not able to handle the amount of water that comes from inside the tap. So, what happens here? The wash basin overfills with water and then starts flowing out. Now, again imagine if this wash basin were not an open wash basin, but a closed one. So, you have plenty of water coming in, but no drainage happening from the bottom. So, then what happens? The water has no place to drain out, and then hence what happens again is that the pressure in this situation, if I need to compare it to the eye, the pressure inside the eye builds up. So, there is an equal area where there is water draining into the eye, which we call as the aqueous humor. There is an area from which this fluid or aqueous humor flows out of the eye. There are blocks in the drainage in the eye, and hence instead of flowing out, this fluid gets accumulated inside the eye, and then the pressure inside the eye starts building up. This is the basic mechanism, or rather a simplistic explanation of how glaucoma can happen. There are two kinds of glaucoma. One is called as primary open angle glaucoma, and again we have another type called as angle closure glaucoma. Now, in primary angle closure glaucoma, there are some structures which go and block the drainage that I talked about, whereas in the open angle glaucoma, the drainage is open. How does this happen? There are a few structures inside the eye. In fact, the drainage area lies between two important structures. One is called as the cornea, which goes like this. Another is called iris, which comes in between like that. And then the drainage area happens to be in between these two structures. So, in open angle glaucoma, these two structures are wide enough to let the fluid flow, but then the drainage happens in the actual drainage area, or the sieve-like structure where the fluid needs to pass out. Whereas in angle closure glaucoma, these wide structures narrow down like that, and then hence there is friction created for the fluid to pass from inside the eye to the outside. This condition is called as angle closure glaucoma. These are the two varied conditions. The symptoms are different. In angle closure glaucoma, the pressure can go up all of a sudden, and then the patient can rush to the hospital because of a very severe pain in the eye and then a lot of redness, and then you may need to end up in a situation where you would have to admit the patient and then give him emergency treatment. Whereas open angle glaucomas show up more slowly, and then they are the more typical ones which keep happening over a period of many, many years, and then they keep destroying your vision over a period of years without you having to know it. The classic explanation or the classic term of silent thief of vision, which I told you, is more associated with the open type of glaucomas as compared to the angle closure glaucomas. Even the angle closure glaucomas can sometimes be very, very dramatic. Let me relate two anecdotes to you. I had a patient who underwent an ultrasound examination for the abdomen. So for the ultrasound examination of the abdomen, the doctor advises that you need to have a full bladder. When you need to have a full bladder, you drink plenty of water. When you drink plenty of water, this place has no other place. Some of it may come out as urine, but then some of it gets absorbed within your blood, and this increases the blood volume and hence the pressure inside the eye. So this narrow angle that I told you, the friction that was created for the passage of the fluid out of the eye, the friction becomes even more because there is more amount of fluid that needs to go out of the eye, and this causes angle closure glaucoma. Did you see the funny situation? The patient drank lot of water for the ultrasound examination of the abdomen to keep his bladder full, and this gentleman ended up with an angle closure glaucoma. I have had a couple of patients who went to a cinema theater and then ended up with an angle closure glaucoma. But then there can be certain diseases which we have, which cannot be cured, but can only be controlled. You just have to remain on medications throughout your life. Glaucoma is a similar situation where we can keep putting medications, but then we cannot cure the condition. So yes, if the medications have to be put, the patient will have to be on medications throughout his life. Now, there are different options available. It's not only the medications that we need to give, there can also be surgeries, there can be laser options. How do we decide what type of a treatment do we need to give to each individual patient? Now, in general, what we do is, in majority of the patients, we start them on medications. What are the medications like? They'll be in the form of eye drops in most of the situations, very rarely tablets or maybe syrups. If the patient is controlled with these medications, we keep them on the same, we continue them, and it's possible that the patient will have to continue these medications through his life. Does he discontinue? If he discontinues these medications, there is a threat that the eye pressure again goes high, and this raised eye pressure can cause the damage to the optic nerve, and then he might lose his vision. Suppose the medications don't work. Suppose we have put the patient on medications, and despite putting them on medications, there is still progression happening with the disease. That means the disease is keeping on going ahead, it is relentless, the damage is keeping on going on, and then he is having a significant loss of vision. What do we do in such situations? We take a call. There are certain situations and scenarios where we can do lasers. There can be lasers like a selective laser trabeculoplasty, which brings down the pressure. Or in situations like an angle closure disease, which I talked to you about, where the passage is very, very narrow, we have a laser called as YAG iridotomy. So what do we do here? We punch a small hole in the iris like that, and then create a bypass area for the fluid to go in, and then the pressure in the eye can get relieved. We do these situations, or we do these surgeries, and then relieve the patient of the pressure. It may work fully, it may not work fully, but these all the times have to be monitored, and then we need to keep looking at them over a period of time, how effective they are. If they are effective, we are happy. If they are not effective, then we need to move on to the next situation. So what is the next situation like? The next situation would be something like a surgery, a proper surgery. And what do we do in this proper surgery? This proper surgery, or rather a surgery, is called as trabeculectomy. In trabeculectomy, we do the same punching of the hole, but then a mechanical hole is created which lets the fluid out of the eye drain out artificially and then collected at something like a lake outside the eye and then gets drained out into the blood system. This surgery of trabeculectomy brings down the eye pressure and thereby reduces the pressure that's put on the optic nerve. So I gave you the simile of a water tap, a wash basin, and then a drainage tube. Trabeculectomy is like creating another artificial outlet so that the fluid gets drained out properly. This relieves the pressure. We do have something called as valves. So in trabeculectomy, we punch a mechanical hole, whereas in valves what we do is we put artificial drainage tubes which are inserted into the eye and then which let the fluid drain out of the eye. These usually are reserved for more refractory kind of situations or refractory kind of glaucomas. Based on the situation, based on the scenario, based on the patient, based on the age, we need to take a call. One critical thing to remember about medications, please remember all medications do have side effects. So your doctor for glaucoma may put you on some medications, but whenever we put any medications, we take a very critical decision. How much is the benefit that we derive out of the medication and how much is the side effect? This is a balance which we always look for. And in glaucoma, when we see this, we always put you on medications when the benefits of these medications far outweigh the risks these medications are posing to you. Similar thing happens with surgery as well. Let me summarize the whole thing for you. So how do you know that you have glaucoma? The most critical thing, again, in understanding that you have glaucoma or diagnosing glaucoma is to visit a doctor. Please be proactive. Please make a visit to the doctor, especially when you turn 40. It becomes all the more important that you have regular visits to your doctor. One visit every year and compulsorily without fail. This can make sure the glaucoma is detected far, far earlier. Go to a doctor, have a yearly checkup after the age of 40, and then this will go a long way in making detection of the glaucoma much, much faster. Once you are put on medications, please don't forget that you have to use your medications regularly without fail. If the glaucoma has been detected right in its infancy or before it has caused any significant damage, or let us say even if it's in its moderate stages, no patient need to go blind. In this era, we have enough treatment, enough technology, enough medications, enough varieties of medications, enough varieties of surgeries, enough know-how, and the doctors are skilled enough to understand the disease and to control the disease and to make sure that no patient ever will go blind because of glaucoma.